Sawadika, Ajama and my friend, I will do presentation about ABP implementing. My title is Pain Among Cancer Patients. Objective is to examine the effectiveness of pain management, music therapy intervention by nurse on pain level of cancer patients. Clinic problem. Pain is a common problem that is experienced by almost all cancer patients, but cannot be completely treated by medication. In contrast, non-pharmacologic intervention could provide a more comprehensive approach in treating different dimensions of pain, pain behavior, and the perceptions of personal control over pain. Statement of the problem. Cancer pain is a common complication of cancer diseases, as cancer pain constitutes different dimensions. It is usually referred to total pain. For example, some chemotherapy drugs can cause numbness and tingling in patient hands and feet, or they might cause a burning sensation at the spot where you have the drug injection, and the radiotherapy can cause skin redness and irritation. Some studies examined the association between cancer pain and psychological distress, including mood disturbance, mood states, depression, distress, emotion distress, psychological well-being, depressive feeling, fear, anxiety, and worry. Meanwhile, this study also found a significant association between chronic cancer pain and psychological distress. Higher level of distress were associated with higher level of pain. Cancer pain severely affects the quality of life of patients. Reducing the pain and suffering of cancer patients is essential to deliver quality care. Pain experienced by cancer patients affects quality of life, physical functioning, social relationship, and mental health. Pain often co-occurs with additional symptoms such as fatigue, sleep disturbance, loss of appetite, and anxiety. Background and significant besides, according to the American Music Therapy Association, music therapy is defined as the clinical and evidence-based use of music intervention to accomplish individualized goals within a therapeutic relationship by a credentialed professional. Many previous studies have indicated a positive effect for its implementation on pain relief. According to Krukeboom, music can withdraw a patient's attention to pain. Searching. The first step was to identify keywords by PSCO. Inclusion criteria. Studies of evidence-based practice about pain management nursing intervention in hospitalized cancer patients with pain and studies published year was from 2010 to 2019. Exclusion criteria. Studies of evidence-based practice about pain management nursing intervention in non-cancer patients and cancer outpatients. This is plasma flow diagram. I chose the 4 articles. Synthesis findings, music preference. In order to provide patients with their music preference, lots of studies have asked a variety of patients to pick their preferred music. Music which is preferred by its listeners will enhance its effectiveness as compared to music in general. In a study, the patient was made to listen to music of their own choice. A significant reduction in pain experienced by the patient was seen post-music therapy. Some equipment needed to be prepared in order to implement music therapy in the world setting level, which includes a set of earphones, a sound player, and a database for music selection. Participants in 2 studies were followed up and data was collected on a daily basis. Statistically significant reduction seen in the pain score in the test group after music therapy. Author said that there was significantly less post-test pain in the music versus the control group in an RCT study. There was a statistically significant reduction in the post-intervention pain scores in the test group compared to the control group. Guideline: both the level of evidence and the grade of recommendation will follow the suggestions given by Sign 2009. The result of a grid assessment of SAM was showed. The recommendation guideline comprised of 5 parts: assessment, preparation, selection of music, during and frequency of music therapy, and evaluation. Assessment. Commendation first is hearing ability and cognitive condition of patient might be assessment. Patient with hearing deficit or cognitive impairment could not reflect the effectiveness of music therapy. Preparation. It is because some people just simply don't like music or allergic to music. Some of them may not be able to focus on music. Using a phone can prevent outside environment from disturbing the patient and also help patient to pay attention to hear the music. There are 3 studies showed that a significant reduction on pain when have an intervention on bed. Selection of music. The first we should using patients' preferred music. Individually chosen music is familiarized, liked, and has meaning for patient, which can distract patient from pain and relax pain more. The music piece can be sung with or without words. The words inside the song may have special meaning to the patient. Without words can avoid the patient from focusing the words, which may affect the effectiveness of music. Duration and frequency of music therapy. At the latest, one session of music therapy with 15 or 20 minute duration should be provided each day, morning and or evening. Evaluation. It can effectively reveal the absolute effect of music intervention on pain relief right after the intervention. Implementation method. Cases introduction. Target setting. Music therapy will be carried out both male and female cancer patients in the oncology department of Guizhou Province People Hospital. Patient of age 18 or above experiencing cancer pain at the level of score is unequal to 5 at the least or more than 5. Without hearing deficit and cognitive impairment, 1 to 4 stage cancer patient. Exclusion criteria is all patients with hearing deficit and those with metastasis to be the breed. The subject was 2 female and 1 male, and all subjects met the inclusion criteria. The mean age is 58.66 years. 3 subjects were married and 1 of the subjects was divorced. And for education level, their high school diploma, junior high school diploma, and elementary school diploma respectively. At the same time, their occupation are freelance farmers and retirement. All 3 patients was hospitalized in the oncology department of Guizhou Province People Hospital, mainly lung cancer and colon cancer. 2 patients were treated with definite orally for macular target therapy, and 1 patient was treated with Exolog therapies. Only 1 of the 3 patients took oxycodone sudden release tablets for pain relief, while the other patient was still undergoing palliative radiotherapy while being treated with molecular charge drug. Their pain score was 5 point, 5 point, and 6 point respectively. Instruments include demographic data questionnaire, the Wong-Baker Faces pain rating scales, music intervention in value form. Preparation phase total 4. The first is obtaining permission. The second is informing the head nurse and patients. The third is conducting study content, and fourth, translating English questionnaire to Chinese. This is my implementing procedure. First, gain permission to gather all necessary equipment. 3 is assist patient to comfortable position. And fourth, inform patient she will not disturb during the music intervention and play music. Finally, we evaluate. This is my process record. This is intervention progress record. Result: data was collected at 8 o'clock p.m. from 20th April to 23rd. Every day had 2 time points before starting music intervention and 5 minutes after music intervention. For comparison of pain level between before and after intervention to examine effectiveness of pain management of music therapy intervention by nurses on pain level of cancer patient, which showed that pain level of patient after intervention had significantly lower than before. This is patient music preference. Discussion. Case 1. In the intervention process of this patient, because of the patient temper and personality, the beginning was not very smooth. Before, I think I ignored the patient character and tempers, which was a key factor that prevented the first intervention from being smooth. Secondly, the patient trust in medical care. During the process of intervention, this patient nurse was responsible for the entire intervention. Only that did the intervention proceed smoothly. Case 2. This case is a female patient. Compared with the other 2 cases, the most obvious characteristics of this patient is that she has no social relationship and the relatively low level of education and a simple social relationship. There is a communication problem. The patient does not understand Mandarin. She only understands dialect, so the process of communication with the patient must be assisted by family members. Case 3. She is an optimistic patient. During the intervention, I fully respect the patient music preferences. At the same time, the patient likes a clean and quiet world environment, because there are reports in literature that the clean and quiet environment can calm the patient emotion and help pain relief. Summary. During the entire intervention process, there are many key points, and there are also many influencing factors such as the patient personality, education, and the patient's trust in the nurse. At the same time, it is also very important to respect the patient's music hobbies. Lesson learned. I felt I need to more practice and deeply understand the knowledge beyond superficial meaning. It also provokes me to do as much as I can, which is good to patient based on evidence in the future. The most important thing is that I have learned a lot of nursing intervention research through this course. Before this, I have not done nursing intervention and don't know how to do it. But now, I have mastered the steps of nursing intervention, precautions, and management during the intervention. Although there will be many difficulties in the middle, with the help of Ajahn Lapana and Ajahn Charavan, I completed the intervention and I enjoy the learning process. I feel very fortunate to be able to perform intervention therapy for cancer patients under the guidance of Ajahn Lapana. For house-related care to intervention, although some difficult and obstacles occurred during the period because of the patient temper, cultural level, personality. In the process of communicating with the Ajahn, I adjusted my communication method with a patient according to the guidance of the Ajahn and the actual situation, slowly solved the difficulties one by one, and established a good trust and cooperation relationship with a patient, which can let me control confounding factors well during the process of intervention. During the intervention period, under the proposal and guidance of Ajahn, and also under the organization of music professional teacher. During my internship, I tried the first public music and cancer patient public welfare activities of Guizhou Province People Hospital Oncology Department, where whether patient or ourselves has benefited a lot. PICU motto is our soul is a benefit for mankind. As long as it benefits to patient, we will stick to it. The main purpose of this intervention is to examine the effectiveness of pain management of music therapy intervention by nurse on pain level of the cancer patient, with 3 cancer patients as the intervention objects. The music type and volume were selected according to the patient music preference, and the pain data before and after the intervention were collected. The pain scoring tool is the Wong-Baker-Face pain rating scale. Percentage was used to describe subjects' demographic and clinical characteristics. Intervention results showed that music therapy, according to the patient preferences, can effectively relieve pain. This is my reference. Music type of patient demographic questionnaire, music intervention in value form, extractable. This is the appraisal of guidelines for research and evaluation agree instrument. This is evaluation result. Sign 2009 strongly recommended. Thank you for Ajahn's guidance. Thank you so much. My presentation is finished.